Step 5. So, female fertility workup. So, before IVF, you have 3 different types of tests: fertility test, pelvic ultrasound scan, and general tests. So, in terms of fertility tests, you really want to find out the cause of your infertility. In terms of regulation of fertility, there are 4 levels. One is regulation of your whole fertility by pituitary gland. Second is the production of eggs. Third is delivery of sperm to the eggs and fertilized embryo from fallopian tubes to the uterus. Fourth is implantation and pregnancy. So when you have a problem with your fertility, you will have a problem in one of these 4 levels. The job of this fertility test is to find out where you have a problem, what the actual problem is. So for that, we need to go very systematically. First, we want to find out if you're having any problem in the level of pituitary, if you're having any problem with the production of pituitary hormones, which regulates your fertility. So the problem here usually is caused by severe mental or physical stress, or deficiency in production of FSH and LH hormones due to genetic causes or any other causes. So this is why your specialist directs their effort to find out if you have any history of severe mental or physical stress. Short-term stress doesn't cause any problem to your fertility, but if you have a severe mental or physical stress, for long term it can cause problem with production of your FSH and LH hormone. And also, if you have severely underweight or overweight, that can cause problem with production of FSH and LH hormones. And they also directly check your FSH and LH hormone, which is day 2, day 3 test, and also they check your prolactin levels, estradiol, and TSH levels. Okay, so the next level is to check if you're actually producing eggs. So if you're actually ovulating your eggs, which can be done by checking your progesterone levels on day 21, or if you have any problem with oversupply or undersupply of eggs. If you have, for example, PCOS, you have an oversupply of eggs and you have lots of follicles competing to become dominant and ovulate, and none of them ovulates. And that's the problem of oversupply of eggs. And you may have a problem of undersupply of eggs, where you are running out of egg reserve, and that's why you have irregular period, you don't ovulate every month, and you are at risk of having premature ovarian insufficiency or early menopause. So the best test for these conditions is markers for egg reserve, which are AMH, anti-mullin hormone, an ultrasound scan to check number of follicles, that's called AFC, antral follicle count. So these are the tests you need to have to check if there is any problem with the production of eggs. Fourth is to check if sperm is getting delivered to the eggs in the fallopian tubes, and embryo is getting delivered back to the uterus, from fallopian tubes back to the uterus. So that is a test to check whether your tubes are open, patent. So that can be detected by checking your history, whether you have a history of chlamydia, severe endometriosis, ectopic pregnancies, and pelvic surgeries that may indicate you may have a tubal problem. And also the tubal patency can be checked using ultrasound scan and by injecting dye or fluid through the uterus into the fallopian tubes, that's called hycosis, or by X-ray called hysterosalpingogram. So next level is to check if you have any conditions which may reduce your chance of implantation. So for example, if you have any history of severe endometriosis, pelvic infection, uterine fibroids, uterine polyps, any sign of adenomyosis or uterine abnormality, these are the conditions where you have a lower chance of implantation. So that can be checked using ultrasound scan, if necessary MRI scan. And if your history suggests you have a severe endometriosis, adenomyosis, uterine polyps, so then you may need to have additional investigations, including MRI, laparoscopy, hysteroscopy, investigations to find out if you have those conditions. So next we move to the pelvic ultrasound scan. When you're doing IVF, you definitely need to have a pelvic ultrasound scan before IVF treatment cycle. And the pelvic ultrasound scan for IVF is not simple gynecological scan. It's a very systemic transvaginal ultrasound scan to find out if there is any factor which may negatively impact your IVF treatment. And that scan needs to be done systematically. So when you have a scan, first sonographer scans your uterus. They measure the size of the uterus and write the actual size of uterus on your report form, and they check the structure of the uterus. Normal uterus should look like pear-shaped. Abnormal uterus can have a different shape, like biconate uterus or arcuate uterus, and they need to check if there is a septum in the inside the uterus, which may negatively impact the chance of implantation. And they also check the myometrium. So the muscle layer of the uterus should be homogeneous, very smooth. If you have fibroids or adenomyosis, your myometrium may be heterogeneous. So and also they check inside the uterine cavity. They check the thickness of the endometrium and check if there's any sign of endometrial polyps, any submucous fibroids, any adhesions, any fluid inside the endometrium. Then they move on to one of the ovaries, and they systematically report on location of the ovary, whether that ovary is easily accessible with a transvaginal scan, and the size of the ovary, features of PCOS, if there's any cyst, and most importantly, they need to count how many antral follicles you have on your ovaries. Any follicle measuring less than 1 centimeter called antral follicles. When you count the number of antral follicles on the right and left and together, that's called antral follicle count. It's exactly same as AMH. It's very reliable test marker of your egg reserve. So then they check the left ovary, systematically report the left ovary, and they also do general ultrasound scanning to check if you have any sign of adhesions, any sign of endometriosis or hydrosalpinx. So, and yes, it's very important that you have to have a very systematic fertility transvaginal ultrasound scan before undergoing IVF treatment. Also, you have a general test for to check if you have any medical problems, any history of surgical complications. That's very important for your specialist to know. And also, they check your body mass index, your blood pressure. And also you will have a blood test to check for your general health, like full blood count, your iron levels, your sugar levels, blood group, and they check for STIs and immunity to rubella and varicella, and blood test for blood-borne viruses. It's very important to have a full workup before IVF, so that you don't have surprises during IVF, and so that your IVF cycle doesn't get interrupted. Yes, sometimes you can find new findings during, for example, ultrasound scan during IVF treatment. If that's the case, that can be addressed, but you should do your best to have a full investigation, so that you will have a straightforward, simple IVF treatment with good chance of success.